All righty, sir. We're recording, and I know who you are, but just so we get it on the record, as always, let's have you say and spell your name for me.
Sure. Karim Baroudi, Karim. Last name is Baroudi, Baroudi, and I'm the Hancock Public Health Commissioner.
All righty, and I guess if you can just bring me up to speed over sort of how, I guess if we want to look back to the month of March, just give me a general synopsis of how March went generally. Not looking for hard numbers or anything, but with vaccinations sort of starting to proliferate a little more, how do you look back at the month of March with how Hancock County did?
I think as far as number of infections, I think in March we lost some ground here. I think mid-March we started seeing a little bit uptick in numbers, increasing in the number of infections. Actually last week they increased substantially, and for us to end up second in the state for the occurrence of the coronavirus disease or incidence of per 100,000, it was a little bit shocking, to be honest with you. Throughout the pandemic here, we've never been number 2 or number 1 for that matter. I mean, we made it to, when we had the big surge in November, back in November, we made it to the top 10, top 15. But it's pretty shocking, and I think it's a good indicators that that it's some to be concerned about at this point. I think with that phase in the whole pandemic and the response to the pandemic, with the vaccination effort underway, full speed now, I think it's kind of, this surge, it's feeling a little different than the other surges that we had back in the fall. When you look at the age of the people infected, it's moving down the age group a little bit. You're seeing more than 30, the 20s, the 30s now are coming back with infections, with almost 72% of our 80 plus population fully vaccinated by now. They are faring pretty good with this surge. We're not seeing a lot of hospitalization, a lot of death, which that was the hallmark of the surge back in November. So I think it's the virus still out there. The vaccination coupled with with the masking and everything else, that's what can keep us safe here for the remainder of the time that we need to stay safe.
Are we looking at because I believe I saw that there wasn't like a cluster or sort of a super spreader event. It's not like there was dozens of cases in a certain isolated like apartment complex or living center. It just seems to be that there's just more that are just kind of spread out, sort of a little more isolated. Would that be correct?
Yes, that's absolutely right. It's the cases are a little isolated. That surge is not connected to one place or one source per se. It's more of widespread in the community. It might be, and that's something got to do with the variants that was identified in our county last week. It's the B117 variant, which is spreads a lot more easily. And it's an indication that, now it's not the time to let our guard down. Our safety precautions should stay up until enough of us are vaccinated and enough of us are immune to kind of prevent the virus from spreading in the first place and from mutating in the second.
Yeah. And frankly, it isn't particularly a Hancock County issue, because I know I saw neighboring counties and other counties in the area. There all seems to be at least a trend, a little bit of an uptick. So it isn't necessarily just Hancock County particularly, but it's probably also, I would imagine that with the weather getting a little nicer, people are probably loosening up a little bit and feeling like they can get out and about, and just being out and about is probably exposing them a little more proportionally more frequently.
Yep. I think, this one thing to keep in mind here, and, to relate to your viewers here, it's the pandemic is ending. No question about it. We have more tools on the toolbox. The biggest and the most important of which is the vaccine. We have, the environmental precautions or the safety precautions we've been taking for a year. The pandemic is ending. How fast that pandemic is going to end is up to all of us and what we do now. We should not let our guard now at this point in the game until the finish line. And we can see the finish line from here. It's just a matter of a little more time.
I hear you. So, what if you can just sort of give me sort of the outlook then for the next, maybe the month of April or the immediate future? Are you guys hosting a mass vaccination clinic sort of in a semi-permanent location and just having people coming in and out, or how are you guys able to do that?
Yeah, I think the hallmark of April, as far as vaccination is concerned, it's going to be there's going to be more supply. So supply is not going to be an issue anymore. We've all heard the governor yesterday, announcing multiple mass vaccination clinics. Especially in our area here, because it was an area of concern, like you said earlier. So I think access to the vaccine is not going to be an issue. It's not in short supply. Everybody should be able to get an appointment and get a vaccine. And I think at this point, I in the middle of this little uptick in numbers, I don't want to call it surge yet, on the hope that it won't be a surge. It's very important to get vaccinated. This is the first step. For all of us to consider really quick, really fast, so we can outpace the virus and its variants.
Okay, and then is there anything I can maybe tease to our viewers, promote, sort of in advance? Are you guys having any sort of large scale clinics or anything coming up soon?
Yeah, I think we're having clinics every week, and I think after the couple mass clinics we've done earlier in the vaccination campaign, we're having them throughout the week at the health department, at the hospital, some of our providers. I think we're holding them at different times to just make it convenient for people to come and get vaccinated. Next week we have 2 clinics of 750 doses each. Those are geared more towards the younger generation. So those clinics are going to be afternoon into the evening, probably from 3 to about 8 or 9 in the evening, to give a chance to our high schoolers, 16 and above. Those are Pfizer clinics, to take advantage of that. This is very important. If you can look at the chart and look at the data and see how the vaccine is making a difference in the infections and the number of hospitalizations and death. So to lower the burden, please get vaccinated. It's extremely important at this point.